To look after you properly and provide good care, we need to keep some information about you. This short film explains what kind of information we may keep and what we do with it. The kinds of information we keep includes your name, address, phone number, and any other contact information you give us, times we have seen you, information about your health, your appointments, what medicines you are taking, what treatment you've had, test results, the name of a close family member, carer or friend. This information is stored in your health record. This means anyone who provides your care, including doctors, nurses, physiotherapists, healthcare assistants, pharmacists and others, all have the information they need to decide how best to look after you. We can use your information to check you're getting the best care and change it if you're not. We also use your information to help other people by reporting on how our services are doing, teaching doctors, nurses and other healthcare workers, and learning more about health through surveys or questionnaires. This information is usually anonymous and won't include your name. We won't share your information with anyone else except when you ask us to share it. We ask you and you say we can. The law says we have to share it. We have special permission to use it, for example for research. We have special permission because it can help lots of people. We use it to make our services better. We check what has happened if something has gone wrong, making sure hospitals, doctors, nurses and dentists get paid for the treatments they give. Sometimes we might need to give other organisations some of your information so that we can all work together to help you. We will tell you if we are going to do this. We may share your information with hospitals and other services who provide healthcare, ambulance services, social services, family doctors, opticians, pharmacies. Everyone providing NHS care has a legal duty to keep your information safe. This means it's the law. Under the General Data Protection Regulation and the Data Protection Act 2018, we are responsible for making sure the information we have about you is confidential. We keep this private unless we need to share it. We will always make sure your rights are respected. We will correct any personal information that is wrong and change anything that is not complete. You can change your mind at any time about sharing your information, and you can tell us if you don't like what we're doing with it. You can ask for copies of information we hold about you. This is called a subject access request. If you would like to ask for a copy of your medical record, please email chcp.accesstorecords@nhs.net or call 01482 347 627. We follow the NHS Records Management Code of Practice. By law, we need to keep your personal information for specific periods of time. Your records will be kept confidential and destroyed securely when the time comes. If you do have concerns or would like further information on how your personal data is handled, you can contact our Data Protection Officer by emailing chcp.customercare@nhs.net. For independent advice, you can contact the Information Commissioner Office, ICO, at Wycliffe House, Water Lane, Wilmslow, Cheshire, SK9 5AF.